Hello, my name is Sheri2, a patient service representative at the Cleveland Clinic. Thank you so much to the board to allow me to present my strategic analysis and recommendations. The mission and vision of the Cleveland Clinic. The Cleveland Clinic was established in 1921 with 4 physicians that came together with their specialties to create new medical procedures to enhance the patient perspective. The Cleveland Clinic at the time was a small location in Cleveland, Ohio. Since then, it has expanded throughout Northeast Ohio to multiple locations. It's in several states and countries. The current corporate strategies are retrenchment and diversification. Retrenchment is a cost savings measure, and diversification is adding new markets. The current cost savings measures at the Cleveland Clinic is to reduce the workforce. In diversification, the Cleveland Clinic has expanded by purchasing a cancer treatment center in Mansfield, Ohio, and also partnering with the Akron General Hospital in Akron, Ohio. Business level strategies are those of service, products, and differentiation. Our motto at the Cleveland Clinic is patients first. We have world-class service. The products are our world-class physician. Currently, Cleveland Clinic is ranked number 1 by U.S. Best Hospitals in cardiology and urology. They're ranked 2 and 3, respectively, for many other specialties. Differentiation. Imagine you have cancer and you live in Worcester, Ohio. You'll need to go to an oncologist for chemotherapy, labs for lab results. You'll need to go to radiation. You'll need to go to radiology for x-rays and CAT scans, and possibly a cardiologist. If you are in Worcester, Ohio, you can do this all at one convenient location. Through an internal factors evaluation, the strategic issues have been their state-of-the-art technology, world-class physicians, brand recognitions. The Cleveland Clinic is world-renowned. The brand means value. Research and development, which is a cornerstone to our philosophy, and patient satisfaction. Strategic issues for internal weaknesses. Outdated facilities. Many times when the Cleveland Clinic expands their operation, they purchase an already current location, and that might be an older, outdated building. Due to the Ebola outbreak, there have become strict rules and regulations. Limited same-day advertised appointments. Currently, the Cleveland Clinic advertises for a same-day appointment. However, the patient may need to travel several hours to get to the location, or also the appointments for certain specialties are limited. For example, if a patient were to call in for a dermatology appointment, there are only 1 to 2 dermatology appointments available per day. There may be hundreds of calls. The reason is there's not enough doctors in certain specialty areas, like dermatology. Also, low patient satisfaction for the phone system. One of the many complaints that Cleveland Clinic receives are due to the phone system. Patients are not satisfied with the hold wait time and also being transferred several times. The external opportunities have been identified through an external factors evaluation. And these are due to the Healthcare Accountability and Affordability Act. 8 million previously uninsured patients now have access to health insurance through the marketplace. The Cleveland Clinic has recently expanded operations to Akron and Mansfield, Ohio. We have a top-notch website for patients to view medical records called MyChart. 7 million more people now have access to Medicaid insurance. And our specialty physicians located in Cleveland, they travel to other locations to provide their specialty services. The external threats have been identified as new Medicare reimbursement laws. In the past, Medicare was reimbursed due to your services. Now it's value-based. If a patient is dissatisfied with their service, they will receive a survey, answer the questions, and we may receive lower reimbursement. New health and safety regulations due to the Ebola. That takes up valuable labor hours from patient service representatives and nurses. Many marketplace insurers are not contracted with the Cleveland Clinic. Although patients have access to gain insurance through the marketplace, not all insurances are providers at Cleveland Clinic. Increased medical records privacy laws also is an additional cost. Now that we've expanded to Akron, we've expanded our competitors. Akron Children's Hospital has very high brand recognition, and they have very many pediatric specialty physicians, more than our Akron location. Medicaid has increased enrollment, however, the reimbursement is one of the lowest of all insurance companies. The strategies that were suggested through the SWOT matrix were increase advertising for advanced technologies. The Cleveland Clinic has MyChart, they have texting options, and they also have virtual booth provider. They have, we could seek a partnership with Akron Children's Hospital, therefore gaining access to current markets that we do not have. We could gain contracts with insurance carriers that we do not have, and specialty physicians. Or some of those outdated facilities, we could either update those or build sleek new designs to enhance the patient experience. Due to the qualitative strategic performance matrix, my recommendation is that we advertise the capabilities we currently have. We have invested money into developing these capabilities. Now we need to obtain some revenue. Advertise the MyChart capabilities, the texting option, and the virtual provider booth to showcase innovative organization on a cusp of new technologies. What is MyChart? MyChart is a way for patients to gain access to limited medical records. They can view test results, they can email their doctors, they can renew prescriptions, make, cancel, even view their appointments. A patient with a cell phone can receive a text message reminder of an appointment. They can confirm, cancel, or reschedule that appointment simply from the touch of a mobile phone. A virtual provider booth is a new booth that we have. It's a 5-bay booth where the patient has a touch screen. They insert their information, and then their medical record is brought up. They verify that everything is correct and insert their bank card for their copayment for their insurance. The booth will measure their height, their weight, and take their temperature. Within moments, a provider will appear on the screen. The provider will gain the symptoms and ask questions to obtain a diagnosis of the patient. Once the patient, this is a live feed, so the patient can interact with the doctor or nurse practitioner. Once the patient has been diagnosed, their prescription can be sent directly to their pharmacy. This not only is a new innovative approach in healthcare, this may provide services to people in rural areas like rural Alaska or Montana, where somebody may need to travel long distances for healthcare. The justification is we have the technology. We need to advertise the technology so our current patients can use the technology to enhance their experience, or also, in addition to that, gain future patients. This may free unnecessary phone calls. If you have the option to do everything from your computer or your phone, you will no longer need to phone call in. Also, texting appointment reminders saves paper, postage, and it saves the environment. The technology is available, not utilized to the fullest. Let's utilize it. Implementation. The first part of implementation is a marketing division. Contract a department in the marketing division strictly for technology, but they have to know all the capabilities of the technology in order to sell it. So we need to take someone from the MyChart department, the virtual provider booth department, and the texting department. We have educational facilities in Beechwood, Ohio that they have computers and desks for everyone to learn all of the capabilities. They can even use their mobile devices. Once all of the marketers are trained in the capabilities, they should have many ideas on how to market it. And the Cleveland Clinic, they advertise through many resources: radio, television, sporting events, community events, billboards, and even they advertise at their current locations. Once we've implemented this, we need to measure the results to make sure the marketing campaign is working. Currently, the Cleveland Clinic does measure the phone call volume, and they track the MyChart usage. What we could do is we could measure the phone call volume before and after, see if it has increased, decreased, or remained constant, and then compare that with the MyChart results and the texting and the virtual provider booth. Find out if those have increased, decreased, or remained constant. If there is a decrease in phone calls and an increase in MyChart usage and an increase in appointments, then the MyChart technology advertising must be working. Also, to make sure that the customers are utilizing and do not have any questions or problems with the new technologies at hand, we need to email, mail, and hand out brochures at the locations, or at least make them available so we can understand our technologies from a patient and customer perspective. Thank you so much for allowing me the opportunity to present my analysis for the Cleveland Clinic.